FM, WNN.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show. I'll tell you what, it's been a terrific holiday season. The amount of food, friends, family, oh my, it's really time to get healthy again. And we're going to talk a lot about on this program tonight, healthy choices that you have and choices that you have in healthcare. And what better place to do that than the You and Your Doctor show here today. Whether you're driving around, returning gifts. I know it's a popular day for that, or exchanging gift cards, or you're just hanging out at home or on Facebook. You come to the right place for the latest information on health. We normally have a doctor join us. I think over the last year, I was looking today, we've had over 100 doctors on the program, and even a few nurse practitioners, including last week, and a doctor of nursing. Including last week, we had on the show Daniel Mock, MSN. He's a clinical cardiothoracic nurse practitioner. So he gave us a lot of the ins and outs of what's going on in cardiovascular surgery and the follow-up care. So that was a great program just this last Friday. That's on the How to Stay Healthy radio show, which we do on Fridays. And he talked a lot about the role in healing, and we're going to get into a little bit of that tonight. We even had a CEO on the program this year. It's been a really tremendous year. We had CEO Trey Abshear of Florida Medical Center, a campus in North Shore and Fort Lauderdale on the program. So today we're going to add to that versatility of the radio show with an owner of a home health care agency who actually he's just a genius with healthcare. He's the guy I go to for healthcare as well as investment and finance. I know he just knows it all. And we're on the Health and Wealth Network, so that's important topics to talk about. So without further ado, I want to introduce Lou Biasi, owner and founder of All County Healthcare Incorporated. Lou, welcome to the program.
Well, David, thank you. And I'm really the vice president of All County Healthcare. But I want to thank all those listeners out there for the past 52 weeks of this year. David's done a fantastic job, hosting our show and bringing on all these fantastic doctors who've tried to do this. And one of the questions prior to going on the air, David said, well, why do we do this show? Well, the purpose of doing this show is primarily to help educate those that are out there. After being in the business for 25 years, every single day I'm getting a call from a different individual. Lou, what do I do about this? What do I do about this? My mom's sick. Where do I go? I have no knowledge of it. What we're trying to do, we're trying to educate the senior community and those that are basically friends and family of seniors, what to do and what happens when the parents or somebody gets sick. Where can I go? What do I do? They just discharged me out of a hospital. There's so many questions that seniors people don't know. And the family members don't know because unfortunately what happens, that's something they don't talk about every day about being sick. But what happens when they do get sick, they really don't know where to turn. I mean, they depend upon a case manager in a hospital or their doctor or somebody else, and they're left alone. Well, the whole purpose of you and your doctor is to live longer and healthier, is to help educate you. What's happening out there in the world? What's happening with cardiac today? What's happening with COPD? What's happening with wound care? There's a lot of new treatments that are coming out. And you know, the population is living longer and longer and longer. I'm a senior myself. I'm almost a super senior. But getting up there as a senior, I was always concerned, what's going to happen to me when I get older? Who's going to take care of me? Living alone as a bachelor, it's sometimes it's very difficult. And I recommend, living alone. My staff bought me one of these, and I recommend this highly for all you seniors who are living alone. They brought me this thing called Mobile Health. Mobile Health. And what happens if you should fall or trip, you have a button on your wrist, you have a neck bracelet that you can wear. And most of these accidents are happening when a senior gets up in the evening to try to go to the John or go to the restroom. He trips and he falls, he breaks a hip. There's no one in the house. What's he going to do? Lie there? And this happened to me. My mom, she was diabetic. And what happened? She basically passed out on the floor. No one found her for 12 hours. She didn't have that bracelet on because I didn't know it at that time. It was 25 years ago. And that's how I got in this home health care business. I said, there's got to be better ways to help people today to learn about health care. So we started this show, and David's been really hosting it. He's done a fantastic job. So tonight we're going to try to educate you a little bit about what's happening in the field of healthcare and what happens when I do get discharged from a hospital. And what's this thing called home health? Am I entitled to home health? What's the difference between Medicare and Medicare Advantage? What's the difference between private care and skilled care and unskilled care? There's all these questions that people ask me. Well, my mom, she needs someone to help her bathe. Well, that's considered respite custodial care. Mm-hmm. So, David, there's so many aspects of healthcare today that we got to educate seniors with. And, and as the population gets older and older, the demand for home health aides, the demand for nurses, the demand for doctors is going to become increasingly greater. And unfortunately, right now, I think in Palm Beach County, we have a shortage of primary care physicians, right?
That's true, definitely.
And we also have a shortage of, I know you're in a hospital setting, we also have a shortage of nurses. Mm-hmm. Trying to find a good nurse, and, shortage of home health aides. So I got a call Christmas Day. Young lady said to me, very prominent young lady said to me, "Oh, Lou, my mom just got out of the hospital. She's going to need some home help, but they gave me some kind of agency that I don't want. I want to use your agency. My mom wants the same girl that she had last time." Well, I said, "Okay, Maria." I said, "You want the same girl? Well, let's try to straighten this out." So we had to get on the phone. She had to get on the phone, call the hospital, because it was her choice. See, it's the choice. You have the choice of where you want to go.
The patient's choice.
Patient's choice, right. A lot of times what happens, hospitals, I'm not knocking anybody. I don't criticize anybody. There's enough business out there for everyone. But, hospitals have sometimes owned their own agencies. Mm-hmm. And they sort of steer the patients to their own agencies, right? And a lot of times, if you have an agency that you used in the past and then you want to use it again, mention to your case manager, "Well, I used this home health agency in the past. I want to use it again." Guess what? It's your choice. It's your choice to go wherever you want. They may suggest something to you or try to steer you in that direction of where their business is, where their home health, to steer you to their agency, but you have the final say. So don't be swayed by what any case manager says to you or what you want. Go where you want to go. Go where if you had a good experience with an agency, go back to that agency. If you had a bad experience with an agency, try a new agency. Try us. Try All County Healthcare. And I think, David, you were up to our office last week, weren't you?
Yeah, it was.
And you visited all our staff?
I met a ton of nurses, great staff. Everyone was super friendly. Phone was ringing off the hook, and as I was talking to people, they're still, taking care of things, moving the call to where it needs to go, but then still informing me. I have a lot to learn in home health, so everyone took a lot of time with me, and you have some great employees there, and a ton of nurses coming in left and right.
And you understand, we've had basically our staff, our in-house staff and our nurses, but with us 17, 18, 20 years. They don't leave. And that's a sign of a good agency when you can keep staff and they don't move around, they don't go. They're very content. and they realize that the only thing that we really care about is patient care.
Mm-hmm.
You know, one thing we don't do at All County, and one thing some companies might be doing, I hear they might be doing, they limit the number of visits they want to give you, right? Because under Medicare, the way Medicare is paid, and by the way, Medicare home care on the Part A is free to you, the patient. There's something you don't have to pay for, was given to you, and you know when, David, in
1966.
1966, under the Social Security Reform Act,
Correct.
under Kennedy and Johnson, they said, hey, seniors, when you get to 65, or if you're totally disabled, you're going to go on the government program called Medicare. Well, prior to that, there was no such thing as Medicare. But in 1966, they brought in Medicare. And you and I were discussing, David, and how old are you now, David?
I'm 40.
And how long you been paying into Medicare?
Since I was 8.
Since he was 8, since he started a job, since he was working, and every month and every day, they took money out of your paycheck to cover for Medicare. The thing I can't understand, it's amazing, I can't understand this. If I paid for something all my life, why would I want to go somewhere else when I can start now reap the benefits?
Doesn't make any
Doesn't
sense,
make
really.
sense?
No.
So what happens is now they have multiple programs out there, and the seniors, this is where the seniors get confused. Even in my own club, you know, I play golf with a group of guys, and they say, well, I'm on Medicare. I said, well, let me see your card. Well, before you know it, it's a Medicare Advantage plan. I said, well, you're really not on Medicare, you're in a Medicare Advantage. No, it's Medicare. No, Medicare Advantage. So there's a difference. Have you seen all these commercials during the enrollment period, which I think ran to December 15th?
Correct.
You have an enrollment period from October to December. You see, and I'm not knocking it. Trust me, if that's what you want to be on, that's what you're on. You've seen all these commercials with Humana and all these say, call this number, call that number. Maybe you get something for free. Well, David and I were discussing, if it's for free, but I don't know what you get for free. You know, some people want to get free legal advice. Well, that's when you go to jail, and that's when your divorce costs you $1 million because it's free legal advice, right?
That's right.
So
you get what you pay for.
Right, but if it's for free, you got to be very careful for it, right?
Yeah.
When they start advertising, you know, for free, it's like even when you want to go to Publix. You know, I go to Publix a lot, and I look at this thing to buy one, get one free. Well, I'm getting it free, but Publix is still making their profit because the provider of that product is paying Publix enough money, so Publix is still making their profit. So it's free to me, but not free to Publix is still making that so-called profit, but the provider is giving it away free, and he's got to make his profit. So you know the markup is up there, so if he can give you something for free, he's still making his profit. So the answer is you got to be careful when you hear this word free. Anything that's free. And so I always say if you've been paying for something for many a year, like Medicare, stay on it. People, believe me, when you get sick, you're going to be thankful that you're on straight Medicare. What I call conventional Medicare, Part A and Part B, traditional Medicare. That's your white, red, and blue card. Keep that and don't let anybody sway you to change that because you may save a few dollars here or may save a few dollars there. Medicare, every hospital, every doctor, every place you want to go will take Medicare. Some of the Medicare Advantage plans hospitals won't take, right? Just recently, I think Delray Community Hospital had a situation with Humana where they didn't carry Humana for a number of months, right? A contract argument, right? So those people had to go somewhere else, but they were taking Medicare. So, you know, everything you want to look at, if you've been paying for something for years, let's talk about it. Stay with straight Medicare. Now, we're a Medicare certified agency. Well, what does that mean? What do you mean a Medicare certified agency? David, well, what does Medicare certified mean? That means the state of Florida, under the ACA regulations, offers 4 licenses. They offer what we call an agency license, non-certified, a certified agency license. They offer a nurse registry, and they offer what they call a companion license. So some of you might be using some companions, meaning the companion license is the person furnishes you a person to help you drive, go shopping, taking you somewhere, but it's no hands-on.
Okay.
Right?
Yeah.
They can't touch the patient, right?
Okay.
Then you have a nurse registry license that has certain provisions in it where they can't touch the patient.
They can provide
They
home
can
health
provide
care.
the home health aid services, right?
Got it.
That's a respite custodial care side. Respite custodial care, they can't provide clinical services for you. They can bathe you, help you with your ADLs. ADLs mean activities for daily living. And what do they consist of? What's an activity? People say activities for daily living. What does that mean? That means bathing, transferring, dressing changes, help with your meal preparation, a number of things. There's about 7 or 8 ADLs that they can help you with. And a lot of you out there that have come down, you have this long-term care insurance. Well, people say, well, I bought this long-term care. What does that mean? Well, long-term care will cover both respite custodial and clinical care. Some of you have a provision in there that you have so many days of elimination, 45 days, 30 days elimination. Means you got to use the first 30 or 45 days you got to pay out of pocket. Then it kicks in. What does that mean? That they'll give you whatever the policy calls for, $100, $200, $300 a day towards your care. That'll even cover you if you go into a nursing home or assisted living facility. And that's another thing we should talk about, right? People say, I'm getting older. I can't maintain my house anymore. My kids have moved away. They want to put me into an assisted living facility. Well, there again has 3 levels. You can go to assisted living facility that starts off with what they call independent living. Then they go to assisted living, and then they go to skilled living. So people might feel secure when their family members are not living nearby them, and they want to basically stay together. They might go what they call an independent living facility, where they can go in, live comfortably in a nice apartment. Then they can have their meals prepared for them, whatever menu they want, they can have done as far as choices they want of services. Then when they find out that they basically can't be left alone and independent, they go into assisted, meaning there's always someone there to help them. It could be a home health aide, there could be an RN there, there could be a nurse there, assisting them on what their needs are. Then when they outgrow that and they really can't be an assisted, they get to a point, where they have to get real skilled nursing, they go into what we call a skilled facility. That means skilled nursing home care, right? Mm-hmm. So as you can see, as the population grows, I live off of 441 in Wellington, and there's a number of these new facilities being built, big and beautiful, and et cetera. And so people have a choice. They either stay at home, they go into a facility, whatever they want as they grow older. And I think most of us, I know me, I like to stay at home. So what I'm going to try to do, I'm going to try to use my long-term care policy that I bought years ago and say I want a home health aide either 12 hours a day or 24 hours a day. At least it assists me. And that's how I got into the business. I got into the business, Dave, many years ago when my dad came down with dementia. And I had a mother that was, calling me every day, there's something wrong with your dad, something wrong with your dad. And I kept running back and forth over there, and it was driving me crazy. So my dad finally got admitted to a hospital. He was sent home. And I asked the case manager, I said, listen, I can't keep doing this. What can I get? I didn't know anything about health care. I didn't know anything about home health aides or what they were. So the case manager said, well, if you went down to May Volan, which at that time was in Boca Raton, was off of, I think, Palmetto Park Road, down by the 95, they said there's a thing called May Volan, and there's a senior services. So I went down to May Volan. I talked to one of the young ladies at senior services. Yeah, she said, you can hire a home health aide. She gave me a neighborhood agency. It was a brand new agency starting up. I hired the home health aide. They went in. My dad at that time was discharged from the hospital. He still had pneumonia. So the home health aide basically saved his life. She took his vital sign. The nurse came in, and we had to readmit him back to the hospital to cure the pneumonia. And I said, this could be a good business. I'm single. Where am I going to go? So I decided. I invested in the company. I bought a portion of the company. I got in the home health care business, and I thought it was a great opportunity at that time to get into the home health care business and to assist these seniors in doing what we had to do. We had a private company, and so we do both the private side through American Staffing and All County Staffing, and we also do the clinical side. So we're a one-stop company. I mean, you call us. We can do both the respite custodial and we can do the clinical side.
Both sides.
Both sides. So, what is the differential? People say, well, what is the differential? Well, one of the differential is that Medicare certified means that you're able to bill Medicare.
Mm-hmm.
And under Medicare, what year again, Dave, you come in? 19 what? 1966?
1966,
Right.
correct.
Under the Social Security Reform Act, Medicare came into existence and says, listen, under Medicare Part A and B, under Part A, just like you're entitled to go to a hospital, you will be entitled to home care once you get discharged from the hospital, or if you basically need home care and your doctor feels you need it, guess what? He will write a script for you and he sends it to an agency, and they'll send out a clinical nurse to do what they call an OASIS form, which they primarily do an assessment of you, which takes about an hour and a half, and they'll make the recommendations to the doctor and also to the office. Oh, you might need physical therapy, you might need occupational therapy, you might need nursing, whatever you may need. So all county on the clinical side, under the certified agency, we do a number of things, and we'll get into that in a few minutes. But the answer is, remember, you're entitled to home care, and there's some restrictions to that. Number one, they got to consider you homebound, and homebound doesn't mean that you have to be bedridden. Homebound means you got to leave the home with assistance, with a cane or somebody's helping you leave the home. And you can still go to your hairdresser, you go to a doctor's appointment, you go shopping, but you got to leave home with assistance.
That's an important definition.
Yeah, doesn't mean that you're homebound, meaning you got to be in bed. Okay? So the answer is you could be primarily, go to the doctor's appointment, go to your hairdresser, and even under the Bush and George Bush, latest George Bush, the latest president, he even primarily extended that to say you can even go to family functions.
Okay.
Right? As long as you get back home, you need assistance. You go to family functions. You're still entitled to home health aid. Now, Dave asked me, being a young guy, am I going to be able to get Medicare when as I retire?
25 years from now.
We don't know.
Yeah,
we don't know. Under this new bill, what they're talking about is basically saying, listen, we're not going to punish those people that are on home care now or on health care now or on Medicare now, but it's the future generation. Maybe we have to take away certain benefits. Maybe we have to say, okay, you're not entitled till you're 70. Mm-hmm. Like, for instance, Social Security. You're entitled to when you're 62 or 65. But to reap the benefits, now you got to be 66 or 67. So as they keep increasing the age, that means they're taking away some of the benefits.
With life expectancy, they're going to increase the age.
Longer.
That's correct.
So, it's changing. Everything is changing, and medicine is changing. And you see a lot of the doctors today. The doctor that you might have had yesterday was on a plan, and I had a friend of mine say, gee, I lost my doctor. Why did you lose your doctor? Well, he's not on that plan anymore. My insurance is so high, I had to go to a new plan. And the new plan, my doctor's not on. So people are getting confused because they've had a doctor for years, and now they got to go to a new doctor. All right? They really don't want to switch that doctor. So, but on Medicare, when you reach 65, you're disabled, it's the most fabulous thing in the world. You can go to any doctor. You don't need basically any referrals. You can call up a doctor and say, Doc, I got these heart palpitations. I got to see you, right? Nobody has to refer you. He'll make an appointment. You can go to any hospital. They'll admit you immediately. If you got Medicare, they take your Medicare, they'll take your supplemental number, and they say, okay, what's a supplemental policy? People say, I got to get a supplement, okay? A supplement, Medicare covers about 80% of all your bills.
Okay.
Right? You saw that on television. What does Medicare cover? It covers around 80% of your bills. But under home care, it covers 100% of it, right? It covers 80% of your doctor's appointments, right? Under Part A, it might cover, 100% of hospital, but 80% of the doctor's bills. So the supplement comes in and says, okay, we're going to pay that 20% that the hospital doesn't cover. That's like a policy where you get to cover the differential of what the Medicare doesn't pay on the Part A, what the Part supplemental will cover, right? And that's what people say, well, you don't need a supplemental policy if you got a Medicare Advantage plan because we give you free this, free that, free this, free that. Well, it's great if you don't need it. But once you need the services, if I want to go to this particular hospital and they don't take that plan, where are you going to go? You got to go to the hospital that takes the plan, okay? So, it's tremendous amount of differences between what you get. When you're 65 and you're ready to sign up for Medicare, know what you're getting. Read all the fine lines. They might tell you that, you got a free prescription, it's free this, free that. Somebody always said to me, if it's for free, be careful. Right? If it's free, be careful. Because anytime I got something for free, down the road it cost me something. When you go to a casino and you say, you got a free dinner tonight, but you lost $1,000 at the gambling table because you got a free dinner. So it wasn't too free, was it?
That was
you know what I'm saying?
Exactly.
That's why these casinos want to give you something for free to bring you in. All right? So, these casinos weren't built. They're built with your money.
Yeah, exactly.
Right? So, it's like, so when you get something other than what you paid for your life, it's a gamble. What am I going to get? What does the plan consist of? So you got any questions to ask me, David? I'll be willing.
Yeah, we're going to take a quick break, but I just want to let the listeners know, I mean, we're off to a roaring start here, but we have a great resource on home health here. Lou Biasi, the number is 1-888-565-1470, and you can ask questions. On the other side, I want to talk to you a little bit about what's going on at All County Healthcare with the skilled nursing, physical therapy, and COPD treatment on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
All right, South Florida and beyond, we're back, and we're here with Lou Biasi. He's the Vice President of All County Healthcare Incorporated. I just want to give out their information. If you have any home health care questions, you can call 1-888-717-7170 or go to allcountyhealthcare.com. And as you know, this radio program is on their Facebook Live page, so just type that into the browser, All County Healthcare INC, and you can see all the radio shows as well as the website now where they're all up there. I saw that last week, Lou, so that's great job there. We talked a lot about Medicare to start out the program, and thank you for explaining so much of it, because paying into it for 32 years, I've always heard the term, never really done the research. But like you said, people turn 65, they should take the time to do that research and know what they're entitled to. And I want to ask you a little bit, though, about some of the services you provide at All County Healthcare, because it's not just one. I mean, there's so many more things than just skilled aides or skilled nurses. Tell us a little bit about the services you provide.
Well, when people go into a hospital, they go in for many things. hip surgery. They get new hips. They get new knees. They go in because they have respiratory problems. They have wound cares. They have wounds. They're going to go in and get wound treatments. There's a number of things that they have. They have some low vision. So some of the programs we offer skilled nursing. Well, what does skilled nursing mean? That's an RN or an LPN who basically come to your home and analyze. What we do is we do an assessment of you when you first come on. It takes about an hour and 15 minutes. And our nurses do a complete home assessment with you and your assessment of all the medications you're taking. They take all your vital signs. We want to know as much about you. What are you taking for medications? What's your problems? So people, they'll do an assessment and they'll recommend. There's a lot of homes we go into, David, where the poor senior, she got to make a decision whether she gets medication, she pays for a medication, or she basically got to pay for a rent, or she's got to,
they're on a fixed income.
Right, she's on a fixed income.
Yeah.
So if we find out that she's basically hurting financially and she's limited with food because we check the refrigerator, automatically we call a social worker in. Okay?
Oh, good to hear.
That social worker will go in and primarily find out, medical social worker, it's an MSW. They'll go in and they'll find out what her needs are. And if we have to, we'll provide her food, we'll provide her whatever needs that's out there in the community that can assist her. And this is tremendous need. I've gone into a home in Palm Beach County, where the lady had no electricity in a big mansion. She was living without electricity. And she didn't know basically how to handle, her husband died, how to handle affairs. We sent in a medical social worker. Her electricity was turned back on. She got food. She had the capability of affording it, but she didn't know where to go to get it. Okay? Mm-hmm. So a medical social worker helps you and assists you when you don't know where to go get the benefits that you're entitled to, right? I get extremely upset because I think our government today can do a lot more for seniors than they're doing right now, right? And being a senior, my motto is, listen, treat our patients the way I want to be treated. So when you have skilled nursing, that nurse will go in, do a complete home assessment. If you need physical therapy, she'll order physical therapy. She'll call the doctor and say you need some physical therapy. You might need some occupational therapy. You might have a mini stroke. So you need both physical and occupational therapy. There's two different therapies. Again, she might realize that because you have some macular degeneration. We have a low vision program also. We offer low vision, right? And and some people that are having problem with their speech, we'll order a speech therapist. So we have speech therapy. We have that medical social work I told you. And let's say that poor lady, she had her hip done. She's having physical therapy. She's having occupational therapy. So it's hard for her to get a bath visit. She can't how to get a bath. We'll send in a home health day to make sure she gets her baths, gets her meal preparation, does her bedroom, does her laundry for a little bit, right?
Which is so important.
That's all covered, right? Mm-hmm. All right. So, again, the wound care. You might have a cubicus, a wound. You might have came out of a facility, have a wound. We are there to do the wound, whatever your wound care doctor wants to recommend. We'll provide whatever medication you get. There's a lot of agencies that won't do wound care because it's very expensive, right? We don't care what it costs us. We do it. We take cases that a lot of agencies won't take because they don't feel it's profitable. But guess what? Making profit is one thing. Taking care of the patients is the most important thing that we look at. And if we take good care of our patients, we know we will get recommendations. I know one senior lady in the community, she's already turned us on to 9 different individuals in the community because she was so happy with our service. If you're happy with something, you will tell other people, right? If you go to a restaurant, you love the food, you'll tell everybody, right?
Word of mouth is still the best.
Word of mouth, right. If you saw a good movie, you'll tell everybody. If you get good home care, you're going to say, gee, I had a great nurse. I have one lady, she says, I don't want to get off home care. I love Victor, my nurse, right? So she wants to keep seeing it, but she got to get off. Certain time when you reach your goals, you're discharged. A lot of people don't know the medications they're taking. So we had medication management. We go in and do a complete analysis of all your medications.
So many medications that some
and how
people
many
take.
people are over-medicated, right?
Over-medicated.
Because one doctor did this, and one doctor did that, and one doctor did this, and they don't know all the medications, right? You know, and a lot of people today in a form of depression, you know, they come down with the beginning of dementia. One of your spouses might have dementia. We have behavioral health. We'll send what we call a nurse, a psychiatric nurse in to analyze what some of your problems are. So we have all the services. One of the greatest services we provide right now, and I want to talk about that because it's very, very, very important. One of the greatest services we have is we are treating, as you know, respiratory disorders are a major problem today, especially around this time of year between pneumonia. Seniors are very prone to pneumonia. If you didn't get your flu and pneumonia shot, make sure you get them, right? About 4 years ago, we were introduced to this, what we call an IPV home therapy. It's intrapulmonary percussive ventilation treatments. It's a big, long terminology for IPV. But what does it mean? IPV treatments. What does IPV mean? A lot of people out there are on oxygen. They're suffering from COPD, asthma, cystic fibrosis, bronchitis, muscular dystrophy, ALS, SMA. And what happens is you can't get that phlegm out of your system, out of your lung system. We have a treatment called IPV. What it is, we come into the home with same treatment you got in the hospital for it. It's you get the doctor orders a nebulizer for you. We put you on this treatment for 7 days and 4 days, and you feel 1,000 times better. We had an 85. If you go on our website, you'll see on our Facebook a recommendation from one of our patients' son. And she was 80-something years old, about 88, 89 years old. And she had a serious disorder. The doctor wanted to put her in hospice. And she said no, she didn't want to go to hospice. She wanted to wait until she at least try to make it to her granddaughter got married. Right? Well, you know, the doctor ordered this thing called, he said, okay, I'm going to send you home with a nebulizer. Knowing the patient and knowing the patient's family, I called the doctor, Doc, what do you think if we add IPV treatment to this young lady, to this older lady? Instead of, let's see how it works. He said, yeah, go ahead. There's nothing to lose. We gave her the IPV treatment for 11 days. When she went back to the doctor, she says, you know, I wouldn't have believed it if I didn't see it with my own eyes. She lived long enough to see her granddaughter get married, which was 2 extra months. 3 extra months she lived. She saw her granddaughter get married. About a month later, she passed. You know, but what the doctor said, he wouldn't believe the difference in her breathing capacity from what she prior to the treatments. So we're the only agency that offers, we have an exclusive on this thing we call IPV at home. If you're on oxygen or you're suffering from COPD and you had frequent admissions to the hospital for pneumonia and you're going in and out of that hospital frequently, listen, tell your doctor to call All County Healthcare and order IPV. Let us assist you with your COPD and pneumonia. We're the only agency that can do that. The old method was with the vest, they were pounding on your chest because you got to get that phlegm up. And the faster you get that phlegm up, the better you are. We've taken a patient who was on oxygen in the middle of summer. We gave him the 7 treatments, 7, 4, 11 treatments. He went in the middle of it, got off the oxygen, he went swimming, came back, and he said he couldn't feel any better. The wife called us and said, you know, I want to buy that machine. Well, it's not, it's not viable, but so the answer is we kept giving treatments, and you can stay on this treatment. And it's the greatest thing and the greatest, if you have a disease like COPD, it's not curable. But guess what? We can help you live a better existence.
Quality of life.
You have better quality of life.
That's right.
So if you have COPD and you want to try it with us, make sure you call All County Healthcare at 954-717-7020. 954-717-7027. Your doctor will write the script, right? We'll send it over to us, and I'll guarantee you'll have great, great, great results. And if you don't, you're not going to be in a worse position because it's not going to hurt you. It's going to only benefit you. We've had top pulmonologists
on this program.
Right. We've had clinical studies done with this program, with this product that shows that we saved hospital readmissions by 12 months. And David, you're in a hospital profession. You know, one of the biggest causes for readmission to the hospital is what?
COPD.
Or respiratory
Yeah,
problems.
which COPD is chronic obstructive pulmonary disease.
Right.
And I just did a little search here, and lung.org is saying more than 11 million people have been diagnosed with COPD. It's now the third leading cause of death in the United States.
Third
Can you
leading
believe
cause of
that?
death, right? Can you believe
Yeah.
that? Why? It's because, number one, if you've been working by asbestos and all these years ago, it's the air we breathe, it's everything else. You're smoking, whatever you're doing. Now, the state of Florida, we've done some analysis on what the state of Florida is paying billions of dollars for COPD treatments to these hospitals. Medicare, government is paying millions of dollars for COPD treatments, right? Here's something that you go to and you can ask your doctor, listen, I want to try this therapy. I want to try IPV therapy. All county, we're the only ones that have this IP therapy in the Tri-County area. Okay? And I can tell you, you will find tremendous relief for it. The only thing I'd ask you is when you do get this and you do try it, please write something on our website so other seniors will realize that there's a benefit out there. The whole program is that we're trying to educate you so that you, as you grow older, you have a better quality of life. Right now, I'm suffering from 2 knee problems, right? And just recently, I had PRP done to my right knee, and I felt 100 times better. Now, Christmas morning, my left knee went. So as I get up and try to hobble around here, I'm going to the orthopedic tomorrow to make sure I get treatment again for the left knee. So as we grow older, you're going to have all these aches and ailments, right? My hands had this thing called trigger finger. So I had to go to a hand surgeon. So all these things here are available to us. The people say, well, gee, I don't know what's wrong with my hands. Well, go see a hand surgeon. Go see a hand doctor. There's specialties for everything. But as you did the research, it's a third leading cause of death. And if you want a better quality of life and you have a respiratory problem, now not everyone qualifies for it, but we have a whole team. David, you saw our respiratory team. It is headed up by a gentleman by the name of Ed Salazar, a respiratory therapist for 40-some-odd years in the Tri-County area. Extremely knowledgeable. He heads up our team of respiratory therapists who go out and are respiratory people who go out and apply this treatment to you. And I'll tell you, we'll do a case study, and you will feel 1,000 times better. So remember, if you're suffering from COPD or asthma or any kind of disorders with therapy, with bronchitis, anything to do that has to do with, as they say, pulmonary diseases or pulmonary therapy, respiratory therapy, or respiratory diseases, call us. Let us try to treat you. Let's see if you're a candidate for the IPV. And if you are a candidate, you'll get the treatments, again, free of charge, no cost to you, right? We're working with the top pulmonologists in the area. We can help you out tremendously, and I know you'll be completely satisfied. So, again, if you want this treatment, call 954-717-7027. If you want to know more about it, ask for one of my case managers, either Donna, ask for Donna Brown, right? She will say, I want to talk to Lou. She will give me the message, say, I want to talk to him right away. He was on the radio. I will call you back, and I'll try to explain it. I'll have Ed Salazar call you, try to explain it to you. If you go to our website, you'll see the whole thing. Our website's it's very, if you noticed our website is how informative it is right now?
It is. It's very informative. It's gone through a
please,
change.
We changed our website around tremendously so that you could at least get some knowledge out of it. It's www.allcountyhealthcare.com. Am I correct?
Correct.
www.allcountyhealthcare.com.
Perfect.
Go to our website and research it. It gives you all the benefits that we have here. And again, was it time for another commercial, David?
Yeah, we got about a minute, but I just want to make an exclamation point on one of those points you made. Is this IPV treatment is FDA approved?
FDA approved.
That's important.
The unit is FDA approved, right?
And you're the only one in the area, Palm Beach County, Broward, and Miami-Dade counties.
It's a portable
FDA
unit that we
approved.
can bring to the homes.
Exactly.
You're given your own mouthpiece. You have a mouthpiece that you take with you, and you have that you can have that for the rest of your life.
Done right in the home.
Right, and this treatment can be done periodically. If you're suffering, say 6 months you're fine, you want to get it again, we can do it again for you.
Perfect. We do have to take a break. Thank you for reminding me. We'll be right back and talk a little bit more about what All County Healthcare Incorporated has to offer on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. We have our home health care show going tonight on the You and Your Doctor show. Lou just mentioned something about PRP, which is platelet-rich plasma injection. As you know, we had Dr. Jonathan Hirsch on the program this year, the orthopedic surgeon here in Boca Raton. He does those PRP treatments in the office. I think it's most orthopedic surgeons do nowadays. But I had just printed something out before the show. I'm probably going to mess up his name a little bit, but Shohei Ohtani, he's the new Los Angeles Angels. He's this baseball player from Japan, Lou, and he pitches. He's a number one pitcher, but then on the day he's not pitching, he hits.
Designated hitter.
Yeah, designated hitter. So you're not going to lose those 5 days in between starts. And he just had PRP treatment
on the shoulder
for a first-degree sprain on the right ulnar collateral ligament, UCL. So that is the shoulder. That was just reported. So he's actually you couldn't be timelier with the PRP topic.
See, David, that's the thing. Everything new is coming up. You hear about stem cell replacement. People are saying, what should I get? Should I get stem cell replacement, which is costly? PRP is not covered by Medicare or any insurance. It's a discretionary thing upon your part if you want to get it done. But more and more things are coming into this whole realm of medicine, curing medicine. Some of the old remedies are coming back in. They talk about this marijuana cream that you can put on your leg and rub it in or drink it and stuff like this. So there's a tremendous amount of new things that are happening in the whole industry of healthcare, which we never thought of before, right? A lot of doctors now are going to more non-conventional medicine, but more into holistic medicine, right? Mm-hmm. I know some people just believe in holistic medicine. They don't believe in conventional medicine. They don't want to take any medication. They don't want to put foreign substances in their body. The funniest thing is when I see a commercial on television, they say, oh, go ask your doctor to try this pill. But guess what? The effects of this, you might have kidney disease, you might have liver disease, you might have a heart attack, you might want to commit suicide. So there's more.
There's more side effects.
Take something that's going to give me all these problems
Isn't
afterwards?
That something? Yeah,
it's amazing,
scary.
right?
Yeah.
So, but we say at All County Healthcare, remember, what are you entitled to? If you don't know what you're entitled to, or you want to ask some questions and you want to call me and talk to me personally, call my office at 954-717-2027. Tell them you want me to give them your phone number, and I'll get back to you the same day.
That's
Right?
954-717.
77027.
Perfect.
Right? And I'll get back to you the same day. Call anybody at my office and say, listen, I heard Lou on the radio. Please, would you give my number and have him call me? You can talk to Donna Brown. You can also talk to Betty Thomas. She'll give you my number, right? Or you can also talk to Norma, one of my coordinators. Just tell him I heard Lou on the radio, your vice president. He said that he would call me back if I had any questions. If you have any questions about what plan you should take, I might, if I don't know the answer, I'll look it up for you. You might want to know, what about home health care? Am I entitled to home health care? And by the way, if you're even on a Medicare Advantage plan, you're still entitled to home health care. The difference with that is they have, it's quite a difference. Very few companies are taking that, okay? But on Medicare home health care, you go to there's many agencies, 1,700 agencies out there. But what I strongly suggest, as I said, our specialty right now is treating respiratory disorders. We have all the nurses. You just heard Diana. Diana's been with me for the last, I think, 10 years. She's been with me. She's fantastic, a great nurse. She works in the Boca area. By the way, we cover Boca. We cover Palm Beach County, Broward County, and Dade County. That's the old license, the old Tri-County license. We had that license for 25 years. So we've been in the business a long time. And, they say, what makes a good agency? How long you've been in the business. So we've been in it a long time.
You've seen every type of case.
We've seen every type of cases. We've seen it all. Mm-hmm. And by the way, we take cases where hospitals can't find a provider because the companies don't want to take them. We just took one the other day from West Boca Community Hospital. I can tell you very candidly, couldn't find we took the case, right? Mm-hmm. Very serious case. So we take we don't turn it down because we can't make money. A lot of companies now are being bought up. Listen, home health and medicine, I always say, is a mom and pop business. When you get sick, you want somebody to talk to you, mm-hmm. right? But unfortunately, as I talk to more and more seniors, they're getting discouraged. Well, my doctor doesn't talk to me. Well, today he can't talk to you anymore because he has to see 60 patients.
You want a senior advocate.
Right.
You said it before.
Want a senior advocate. You want someone's going to talk to you. Mm-hmm. Just like Diana says, we'll come in, we'll explain everything there is to explain, and you make the decision. I'm very, very serious about this. You want quality care. One thing All County does specialize in is quality care. You're treated like family. Go to our website, read some of the things on our Facebook that people have written in about us, right? We have a 4.5-star rating with Medicare out of 5. Hard to beat that, right?
That's great to hear.
We're going to get the 5-star rating. We have people coming from north. Agencies recommend our agency because they see our website. They recommend us to take over their patients. We have 20 patients now. We're just taking over out of Miami because people are recommending us. So the answer is, again, this is a service that you're entitled to. And when a doctor orders home health, some people refuse it. I can't understand it. Why do you refuse? Because I don't want anybody in my house? Why would you refuse something that could help you, benefit you?
Yeah,
right?
You need that assistance.
Right.
You said it before. The key word is assistance.
Right.
Your doctor says you need that assistance. The hospital discharges you and says, you're ready to leave the hospital, but you still need assistance at home. You're still homeward bound, and you were kind enough to give that definition before. Now, but the key word is you need assistance, and that's what you guys.
You got to leave home with some form of assistance. But the question is, the doctor knows that, and if you have a wound, or you need some therapy, don't feel that you did that. I think people refuse it because they think they have to pay for it. They're not knowledgeable. Mm-hmm. Well, this is something that's given to you. They already paid for it. They've already paid for it. You paid it all your life. If you're entitled to it, get it. If you're not happy with the service, then you can try another company, another service. But if a doctor orders home health, don't be a fool not to take advantage of it. Because these clinicians, whether they're physical therapists, occupational therapists, they're there to help you get better. The hospital can do so much. I always say you can heal a lot faster at home than you can in a hospital. Mm-hmm. I had a friend of mine from Boston. He was in the hospital for pneumonia, and he begged me to get him out of there. Get me out of this hospital. Get me out of this hospital. No one wants to stay in a hospital if they don't have to.
Well, higher chance of infection, too, because there's more people in a smaller area.
And, MRSA's running wild in hospitals. This whole idea of staph infection. You want to get home. Mm-hmm. If you can get home, chances are we can do the same thing at home as we can do in the hospital.
Mm-hmm.
But in a one-on-one setting, right?
Exactly.
And if you're living alone, remember what I told you. Try to get some mobile help. That's that wrist bracelet that you get. I don't sell them. I'm not marketing, but I can tell you, it's a great assistance if you're living at home. If there's anything you want to know at any time, please call me personally. Talk to me personally. I'm in the office mostly every day. If I'm not out with a doctor, I'm not out with a patient, they'll get to me on my cell phone. I'll call you right back immediately. Call my office at 954-717-7027. We've had thousands and thousands of patients that we've taken care of over the past 25 years. How many more minutes we got, David?
2 minutes.
2 more minutes.
Yeah.
So listen, I want to thank everyone who's been a patient of All County. I want to thank anyone who's might be a patient of All County. I hope you never have to be a patient. But if you need home care, call us. And our staff, David and I, we wish you all a very, very healthy and happy New Year. We want you, please, as we grow older, the years go by faster, and enjoy your life.
And I'll just give a little testimonial here. I will say that you will answer the phone because every time I've ever called you on your cell phone, you pick up. I don't think there's a time you've never picked up.
And I'll call you right back.
Yeah, no, you always do. And I just want to thank you, Lou, for giving us the opportunity to have doctors on the show each week. I mean, we already have January almost booked. It's hard to believe, but a lot of doctors want to come on in the new year and talk about all these new medical breakthroughs that are happening in neurology, cardiology, orthopedics. You're going to see an orthopedic tomorrow. Endocrinologists want to come on the show, talk about the latest in diabetes drugs and treatment.
Well, I don't want to interrupt you. We had a doctor that was on the show, and he got a referral from Canada.
That's right. That is a true statement.
You got a referral from Canada. Canadians come and see him. Is that it?
Yeah, we're on a minute. We have a minute. They play the music at the end, and we know that we have to wrap it up.
David, I want to wish you and your family a happy New Year, and I want to thank you for being a great, great, great commentator. I want to thank you for being a great host and steering the doctors in the right direction. And I want to thank all those doctors who are on our show, who sponsored our show. I want to thank them wholeheartedly, and I wish they all have a healthy and happy New Year. And to all my senior friends out there, please, if you need us, call us. You got all the numbers. Call us. Enjoy your new year. Enjoy tomorrow. Enjoy today. Live every day like it's your last.
Thanks, Lou. Have a good one.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff,